first of all, you've been at this since 2009, and let's talk about what this is. Tell us what it is that you would like to see happening in our world today.
Okay. Well, it starts with what you just said, merging the two, creating the bridge that's going to combine traditional medicine and insurance, because this goes on in the insurance industry, and holistic health and wellness, really shifting our healthcare to a wellness model, not a sick or symptom model. That's kind of what it is now. And we all know it's a problem. Everybody knows it's a problem, but we don't know how to get out of it. And I am motivated to try to figure out how to do that and what we can do to do that.
So what do you see? First of all, let's talk about how do we say this is a sick model? I mean, maybe there's people listening to us today going, well, what do you mean it's a sick model? It's the sick care model, I should say.
Well, a lot of the things that we go to the doctor for treat our symptoms. They don't actually treat the cause of the symptoms.
Right.
So ultimately, we're moving towards a functional medicine where it's like, what is going on with the body and why are we feeling this? And it goes into our environment, our food for sure, our stress levels, all those things, the things you talk about in your show, create the baseline for our health and wellness. But what we're going to see is a symptom of allergies, of immune responses or autoimmune disorders. And we're treating the symptoms of that, but we're not actually getting to the cause of why we are having those symptoms. Right. So ultimately that's the goal. But do I think we could start with looking at traditional illnesses, whether it be eczema or cancer, and saying, are there other things we can do besides the main chemotherapy or the steroid cream, right?
Right.
Could we use some essential oils on eczema? Absolutely. It immediately works. So looking at how to bridge those things and at least work towards our health and wellness using more healthy approaches, not just traditional medicine. But I'm with you. We need it too. I broke my arm. I needed to get an x-ray and I needed to get a CAT. I mean, I'm not going to put words on that, So I did later.
Right.
Take me to the ER.
If you're having a heart attack, you need to go into the hospital. If you're having a stroke, there are things that we absolutely need that function for. So I want to get into the mentality behind both sides, right? Mm-hmm. So I see, how do I want to explain this? I see a problem with our communities in a big, big way. All right. I was in the automotive industry for 30 plus years, and I love it because in my industry, I was all about preventative care for the car. I was all about maintenance for the car. I ran oil change shops for 30 years. So it was about, if you want to extend the life of the car, you have to take care of it. You got to rotate the tires. You got to change the tires out. You got to change the oil. We have to do these things. And people seem to kind of grasp hold of this idea when it comes to your car, when it comes to maintaining your home. Mm-hmm. We know, every 5 years or maybe sooner, depending on where you live, you got to paint the outside of the house, or you're going to have, whatever it's built from that's going to deteriorate. But we don't seem to transfer this knowledge to the body. Does that make sense?
Absolutely. In the book, I compared it to homeowners insurance and auto insurance because they don't pay for our oil changes and our tires and our gasoline, and the mentality of the communities or a lot of the patients that I have seen is, well, if it's not covered by my insurance, I'm not doing it.
Okay, Yeah. And that becomes a problem. But even before you even get to whether insurance covers it or not, people are not seeing their bodies that way either. Right. If it's not broken, if there's not apparent, symptoms, I'm not going to fix it. Or it takes a crisis to happen to their body before they're even willing to take a look at being proactive with it. Does that make sense?
Absolutely. Yeah, the way I focused on it was the lack of self-care. It's really a pandemic of lack of self-nurturing. I mean, we just stopped doing it because we're relying on other people, mostly our doctors and hospitals, to fix it when we we run out of gas when we
Right.
break down. So we want to focus on self-care and how to
Right.
do that. And that's what you're talking about. And that's what all your shows are about.
Yeah. Well, and so where's, okay, so we think that, okay, for one part of that little piece of the puzzle is just even getting people to understand that you can do self-care to make a difference in your overall health and wellness. But what about the people who just want that quick fix? How do we reach that population where they've been brainwashed, in my opinion, into feeling like a pill is going to fix any ill they have?
Those are my favorite clients when they walk in the door, because they've said, I have tried everything I can try. I've tried, and I've been to doctor after doctor, and they finally, the doctors say, well, there's nothing more we can do for you. Right. And that was my own story too. I write the story about my daughter's allergies, and the doctors just kept giving her antibiotics, and it was an allergy that we were not fixing. So we had to get to the heart of that. And I just said, okay, if you can't help me, I'm going to start finding people who can. And that's when I started to go outside the box of traditional medicine until I found things that worked. And once I found those things that worked, I was already open to that. I have 6 chiropractors in my family, so I kind of knew a pathway to start. But once I started looking at all those other modalities, that's when I started seeing that when my clients complain about the similar thing, I'm like, have you tried this? Have you tried that? Have you tried? Well, I know this practitioner, maybe try to go with them. So I started doing this case management approach, and lo and behold, they were getting better, So that's what started the whole thing in my practice. And then I thought, well, we should all do this. Why aren't we all doing this? Yeah.
Yeah, exactly.